Hello and welcome. Since this week we are looking into healthcare, I figured it'd be a great opportunity to go through some healthcare statistics on the worldwide scale. So I'm going to walk through a couple of infographics and hopefully this is interesting. So these circles that I'm going to show you are going to represent populations. So China has a pretty big population, over a billion individuals. United States, 313 million. Mexico, United Kingdom. You see India has a pretty large population as well, 1.2 billion. Russia, 142 million. Mongolia, 2.8 million. Australia, 22 million. So to give you a sense of the different countries and their size. Now you'll see the countries represented in the study are also from different places, different economic backgrounds. So we have Ghana, we have Japan, we've got Colombia, the United Kingdom, so on and so forth. And then the color coordination links to the gross national income per capita. There's also a really awesome kind of shortcut where it shows the um, shorthand version of the country. So the U.S., you see, our national income per capita is right around 49,000. Singapore, which is the yellow ones, at about 59,000. GR, which is Germany, 40,000. Canada, 39,000, and so on and so forth. Then we look at the health expenditure. So per capita total expenditure on health, and this is U.S. dollars, 2010 U.S. dollars. So again, this study is a little bit dated because it comes from 2010, but it's a nice kind of focal point just to see where things were at that time in our country and worldwide. So the U.S. About $8,000 spent a year. Canada about 5,000. Australia about 5,000. All the way down to Ghana at about $69 per year. Afghanistan at about $44 per year. Okay, then we'll also take a look at the life expectancy averaged out for both sexes. You see that Japan life expectancy is around 83, Singapore's at about 82, France 82, Canada 82, Australia 82, um, Germany 81, the United Kingdom 80, the U.S. at 79, on down Afghanistan at 60. What sort of health services are available? Uh, Contraceptive prevalence. There's all sorts of neat things. Immunization coverages for 1 year olds, measles, etc. And you can see where there's a correlation between life expectancy rate, immunization coverage, different risk factors. So improved drinking water. So this is just a really interesting infograph that ties in the different elements to the healthcare system. Health systems, hospital beds per 10,000 population. You'll see U.S. is kind of middle of the road here at about 30. Japan's kind of the leader as far as the number of hospital beds at 137. Afghanistan's got about 4. And that is pretty much all the information uh, listed on that particular infograph. This is great because you can continue to go down and learn a little bit more. So the number of practicing physicians in the U.S. per 1,000 people is 3.1. 87.5% of practicing U.S. physicians are specialists. 12.5% of practicing U.S. physicians are general. So lots of the physicians are specialists. $18,000 is the average cost of a hospital stay in the U.S. 6,200 is the average cost of a hospital stay in all the other countries. 85% higher than average cost of hospital services. 2 times more tests, including MRI, CT scans, all these things, for every 1,000 people in the U.S. You'll see this comes from George Washington University, their School of Public Health. So thank you for taking a moment just to learn about some statistics related to healthcare. Hopefully this can help frame some of our conversation in the healthcare discussion board this week. Thank you, and